Hello, my name is JC Strong, South Alabama College of Nursing. So first thing I'm going to do is I'm going to verify your order. So orders for Rocephin 1 gram IV every 8 hours. I'm going to verify hospital policy. Next thing I'm going to do is I'm going to gather my equipment. And I'm going to perform hand hygiene. The next thing I'm going to do is I'm going to verify your 2 patient identifiers. So your name is Jaguar Jones. Your medical record number is 417-6352, 417-6352. I'm going to assess you for allergies. So your bracelet says penicillin and you're allergic to penicillin on your orders. So are you allergic to anything else?
No.
And next I'm going to explain the procedure to you. So today I'm going to be performing an IV insertion on you, and we're going to be giving you Rocephin. So the next thing I'm going to do is I am going to provide some privacy. So I'm going to close the curtain, and I'm going to move the trash can, and perform hand hygiene. And I'm going to don my goggles, but I already have them on. So the next thing I'm going to do is I am going to raise the bed to working height. So I would raise it and lower the side rails, and I would get you to be in either a supine position or sitting upright, but you're already sitting for me. So the next thing I'm going to do is I'm going to open my equipment using sterile technique. And the next thing I'm going to do is I'm going to swab my injection cap. And now I'm going to attach my syringe. I'm going to prime my tubing, and I'm going to loosen my protection cap and place it back on the sterile field. Okay, so the next thing I'm going to do is I'm going to place a water proof dressing underneath the arm. Okay, and I'm going to apply the tourniquet 4 to 6 inches above the insertion site. And then I would assess the vein for appropriateness, and it is appropriate. So the next thing I would do is I would swab. So the first thing I'm going to do is I'm going to clean the area with chlorhexidine, and I would do this in circular motions, in horizontal motions, and vertical motions for 30 seconds. Then I would let the area dry, and then making sure not to touch the area. I would cap my needle and then pull the skin tight, and I would anchor the vein 1.5 to 2 inches below the insertion site, and I would advise the patient to remain still and that there's going to be a quick stick. And now I'm going to insert the needle at a 10 to 30 degree angle. And I would observe for blood return. And there is blood return, so I'm going to advance it another 1/4 of an inch. And then I'm going to, making sure that the stylet doesn't go any further, I'm going to advance the hub all the way. And then I would secure the catheter and pull the tourniquet. And then I would apply firm pressure about 1 1/4 inch above the insertion site and pull the stylet out and put it into a sharps container. And then I would remove the cap. And I would apply it onto my catheter. And then I would assess for blood return with gentle aspiration. And then there was blood return, so I'm going to flush the vein with the remaining saline. And now I'm going to remove the syringe and place it into a sharps container. And now I'm going to secure the catheter. And I'm going to apply my Tegaderm dressing. Making sure not to go above the hub. And I would secure the catheter in place. And making sure not to put it over the hub. And then I would dispose of all my equipment, and I would remove my gloves, glove to glove, and then skin to skin. And I would write my name, my date, the size of the gauge, and I would apply it to the edge of the Tegaderm. And I would reposition the patient for comfort and safety, and I would lower the bed, and I would raise the side rails, and then I would perform hand hygiene. And then I would go to the nurse's station and perform documentation. I would state the date, the time. I would describe the location of the IV and my number of attempts. And then I would tell them that my patient tolerated it and didn't have any complaints. There was no swelling. And now I'm going to discontinue the IV. So the first thing I would do is I would raise the bed to working height and lower the side rail. Next thing I would do is I would secure the catheter while pulling the Tegaderm towards the insertion site. Next thing I would do is I would take my 2x2 gauze, I would place it on top of the insertion site. And then I would apply pressure and then pull straight back. And I would check the catheter for intactness before disposing of it, and then I would dispose of it into the sharps container. And I would apply pressure to the site for at least 30 seconds. If the patient is on anticoagulants, then I would apply pressure for up to 5 to 10 minutes. And then I would take the gauze off, dispose of the gauze, and then I would take my gloves off. And I would dispose of all my equipment, and I would document, and I would lower the bed rail, or raise the side rail and lower the bed, and then perform hand hygiene.